We've been getting calls from all over the country, not only from school counselors, but from parents, from community people. We were getting calls from Benke. And then when we started looking at the numbers, we thought, well, you know what? We didn't have a conference this year. We should do something to talk about not just suicide, but some of the things, the signs, the symptoms, and what you should not do in the event there is an attempt or there is an actual suicide.
And the present data on suicides and the attempt to take one's own life in Belize have prompted the Mental Health Association and the Ministry of Health to take a closer look at the situation. The records show that more young Belizeans are taking their lives or trying to. Psychiatrist Dr. Claudina Cayetano is in charge of government's mental health program.
You see that in almost every part of the world where suicide is much more higher among the youth. So we are also experiencing that in Belize, and that's why we are concerned, because suicide is preventable. People should not die because of suicide. And so we think that is an opportunity to bring teachers and counselors and health practitioners together to talk about then what is that can be done to be able to lower our numbers.
And many people are showing an interest in this growing problem of suicide. In the first day of the conference, there was attendance from various sectors including school counselors, health professionals, social workers, the Belize Police Department, and the Belize Defense Force. The concern is not without reason, as records for 2011 show that so far there have been 14 suicides, 11 of these by young men and the rest by females. On the flip side, there have been 53 attempted suicides, but these are only those that have been reported. But what really do these numbers mean?
In Central America, for example, Nicaragua has 15 for 100,000, and Belize is only half of that. So with other regions, when we compare ourselves, we are not as high. And when we compare ourselves to the Caribbean, we are also not as high. But what is important is for us to compare ourselves with previous years, how we are doing compared to the previous years. And right now we cannot say because we are at the mid-year. This is September. And so we have a number which we have had a higher number previously. In 2001 we had a higher number than where we are now. We need to wait until the end to see. Now, our attempts, that's what I was saying, I don't think they're as high, but they probably are high, but people are not coming to the clinics.
Mental health therapist and counselor Jennifer Lovell says one suicide is one too many.
From a psychosocial model, we believe that one suicide is too many. That's our belief. And so we would, if we have one suicide, would want to find out do an autopsy and find out what happened, what was the reason. But when we start seeing the numbers, because in three months there were 9 completed suicides, I think that's a lot.
That was this year?
Yeah.
To better monitor the situation in the country, the Ministry of Health, through the Epidemiology Department, has developed an alert system where every suicide attempt is recorded. The system is intended to allow health professionals to reach out and offer help. The only problem is that many persons who need it are reaching out for the lifeline.
It's important that we can capture these people because we want to be able to provide them treatment. The people who attempt suicide, they can attempt again and again. So this number is not a high number. It's a low number. It will be good that we get them to come. Again, people don't come because of the stigma. People think that if you suffer from depression or anxiety, or if you attempt suicide, or if you talk about your problems, something is wrong. You're weak. You're not strong. So they don't necessarily come and seek help. So the number, we should be able to be seeing a bigger number because for every suicide, normally you see 10 attempts, and for now what we're seeing is a lower number of attempts, but then we have the number of suicide.
In an effort to better understand the phenomenon of suicide, the Mental Health Association is looking at topics such as a historical look at suicide, the status of suicide in Belize, self-injurious behavior versus suicidal behavior, drugs, alcohol and suicidal behavior, childhood trauma and suicide later in life, staying alive, recognition and prevention of suicide, and psychological intervention and guide in coping. The conference concludes tomorrow. Dalalay Kyle for Love News.